Greetings and salutation. I'm Jennifer Kennedy, the lead for compliance and quality at CHAP, and welcome to CHAPcast. Today, we're going to attack the topic of the National Home Health and Hospice Enrollment Moratorium, which was effective on May 13th, 2026. So we're going to set the stage just a little bit. And when I say we, I'm meaning I'm on with my trusty coworker, friend, companion, whatever else we can say, Kim Skian, who is our VP for accreditation. Hey, Kim, how you doing?
Hey, Jennifer, I feel like we've had many of these sessions related to CMS and other regulatory, right, and compliance challenges over the years. So happy to be here with you again.
Yeah, absolutely. And we're just going to talk it out. So let's set the stage before we get into the details. The moratorium was announced, as I mentioned, on May 13th, and it is for home health and hospice, and we'll get into some details. Well, I think that for me, the timing was unexpected. That it came overall was not unexpected. And Kim, I would invite you to weigh in on that. But seeing that a moratorium was established, I think I felt like it has been coming. This decision has been coming from CMS for a while. They just had to get their logistical ducks in a row. And all you had to do was watch all of the stuff that has been unfolding, particularly on hospice fraud and abuse, to know definitely that a moratorium was expected. What are your thoughts on that, Kim?
I agree. I mean, we definitely knew that something was coming, even as far back as the Blumenauer, the congressional bill that was never moved forward because Congressman Blumenauer retired. For me, it was looking at the scope, the breadth and scope, including both home health and hospice.
Now,
as
that
a
was
nationwide
surprising.
moratorium, right? And
Yeah.
and again, the immediate effectiveness of it. But as we'll talk about in a minute, it is somewhat less onerous than the home health moratorium was in 2013. But we at CHAP, we watch this, right? As you said, you love the smell of the Federal Register in the morning, and we trust you. We trust you to, stay on top of all of the everything that's coming down the pike. And so at CHAP, we were prepared, anticipating what the potential impact could be, certainly on our customers as well as our organization. So that's why we were able, I believe, to be able to pivot as quickly as we were, to be able to provide the insight and support, at least on the information that has been that's available so far.
Yeah, absolutely. And I will say that while I wasn't surprised about the hospice moratorium, the home health actually did take me a little bit unawares. But, given that, I read the OIG stuff on a regular basis as well, and seeing all of the home health fraud and abuse, I guess, maybe in the overall context, it's not too surprising. But let's go ahead and get into some of the nuts and bolts, Kim, of what the provisions in the moratorium, both of them, would be. So your choice, you want to start with hospice or home health?
Well, to be honest, I think the provisions are very similar. If you look at the language in both Federal Register the Register announcements, the bottom line is the moratorium is in effect for all initial enrollments. They refer to it as applications. That's the CMS 855A that have been received as of the effective date. So, in other words, any 855A for a hospice or home health agency or hospice or home health branch or additional practice location as well as certain changes in ownership that require an initial enrollment or 855A. If that application was received by the MAC, the Medicare Administrative Contractor, before May 13th, then it's presumed that those applications are going to be able to proceed. So an organization that had submitted the 855A and is waiting for a survey, will continue to be processed. And again, there are some other caveats associated with that, but they both were both are really essentially the same. That the line in the sand that I'm calling it is May 13th. If somebody has an application in before May 13th, then they can proceed. If they require an application as of May 13th and forward through the moratorium, they will be denied, or they either not submitted or it will be denied by CMS.
This is a nationwide, yes. This is a nationwide moratoria, and it is applicable to Medicare, correct?
Yes. Yep. Yes, the federal moratoria is applicable to Medicare, or Medicare-certified organizations. I want to be clear about that. It's not just the billing of Medicare, it's the Medicare-certified organizations. Any organization that's required to be Medicare-certified will, this applies to them. And yes, it applies to anywhere in the United States, including all states, territories, and the District of Columbia. And the reason for this, the rationale, is because in past moratoria, there has been an experience where some providers will move from the area of the moratorium and to an area outside of the moratorium. And this is CMS's way to be able to limit, and I'm just going to use the term bad actors from making those moves and, moving to additional locations. Unfortunately, it also does limit, restricts any organizations that do want to expand, right, or open or expand.
Right. Now, in the provisions, there are some caveats or direct guidance as how it does not apply. So can we talk about those for just a couple minutes?
Sure. So any change in practice location, meaning if an agency is moving to a different address, for example, or just moving that location, as long as the move is again within the moratoria and not outside of the moratorium, which in this case it can't be outside of the moratorium since it's so broad and nationwide. So they can move their practice or the agency. They can change their address, their phone numbers, things like that, and then changes in ownership that do not require an initial enrollment. And there's just a couple of things there. CMS also, or the MACs, were very clear that even though an 855A is submitted, even if it was submitted before the moratorium, and or a change in ownership is submitted and they're outside of what CMS calls the 36-month rule, meaning you can't sell, change ownership with very few exceptions if within 36 months of initial certification or the most recent change of ownership. The issue here is CMS still reserves the right to deny an 855 or deny or require an initial enrollment, on a CHOW. So by and large, organizations just need to understand that even if they have submitted, they it's been received, and that's the word, right, prior to the start of the moratorium, if CMS denies for any reason, although there's a rebuttal process, but if they deny, then the organization is then placed into the moratorium.
It's kind of like what I said to you this morning, that HOPE records for hospice, they may be submitted, but they're not, unless they are accepted, it's not a good record. So it's kind of the same principle that applies here.
Yeah.
And this moratoria is good for 6 months. That puts us somewhere around November 13th, I think, for when the 6 months expires. Could CMS lift or extend, or what are their options there as considerations?
So again, in the moratorium, it does state CMS can lift the moratorium, a moratorium or moratoria at any time for different reasons, some of which related to disasters. But one of the key provisions is circumstances warranting the imposition of the moratorium have abated, or CMS has implemented program safeguards to address the program vulnerability. Here's the thing. We know from the 2013 home health moratorium that was renewed, I think 9 times. It was like between 2013 and almost into 2019. So the key here is I think we need to be prepared because it's unlikely that CMS is going to determine that the risk has abated or that they have put the safeguards in place within 6 months. We certainly can hope. We certainly, I know on the national level and the state association level, and all of us in the industry are certainly advocating for the moratoria not to be longer than absolutely necessary. The other thing that can happen is they may make a decision to reduce the footprint, if you will, of the moratoria, depending on where they are in terms of whatever information that they have. But that decision will then be published in the Federal Register.
Right. And I did read in the Federal Register notices that they did feel that putting a restriction on enrollment of new providers wasn't going to impact beneficiary current access, either to home health or hospice. So I guess that would be one metric they would be assessing during this moratoria period, is if there are any access issues. That's my 2 cents. What do you think about that?
Well, I would agree with that. And I know that that's one of the points that the state and national associations have made, in opposition against a nationwide moratorium. But we have seen other individual states implement efforts such as California with their moratorium for hospice, as well as, for example, CON, Certificate of Need states. So, there already are some guardrails, if you will, in some places. But again, I think CMS, my assumption is that this is a pause to be able to allow for the applicants that are currently in the system to be very thoroughly vetted. And that's an extreme warning to anybody who does have you made it through it, you have your application in, but everything's going to be scrutinized very, very thoroughly, until they can make that determination. Yeah.
Right. Yeah, exactly. Catch them at the beginning of the process, basically. So CMS, they did, to my recollection, talk about states and the state's ability to establish their own moratoriums. Do you want to tell us a little bit about that?
Sure. So we know that in the moratorium, they did discuss that CMS stated that it's in Medicaid and CHIP beneficiaries' best interest to allow each state to decide whether some form of a home health or hospice provider moratorium is appropriate for their respective programs. So they are leaving it to the states, although they are encouraging states to look very closely at the moratorium and even offering guidance. We do know that as of today, or as of May 14th, the state of Ohio implemented a moratorium on their Medicaid program. Now, it's not just the state plan, but it's all of the Medicaid programs. So your Medicaid waivers, your, those that pertain even to, potentially non-medical, patients, not just those that would have otherwise received, Medicaid state plan services. So everyone, every provider really should be connecting with their state association and their state agencies to see how, in fact, the moratorium may impact them. We know that when DMEPOS moratorium was imposed in February, that there were states right off the bat that did implement moratorium specific for their states. So it's just something that we do encourage really every provider to be contacting their own states, as well as again using really utilizing the support of their state associations.
Absolutely. They're a great resource, and they really do have their finger on the pulse of what's happening in their state. So that's really great advice. And if you're not, if you're a provider that's not connected with your state organization, maybe you do have connection to a national organization. Hopefully you can leverage your relationship there to see if there are any state announcements that they make as well. So
I agree.
a lot going on, Kim.
Absolutely. The other thing, just to make a note, the moratorium does not affect licensure, state licensure. That's actually state specific. So unless a state has a certificate of need requirement, or any sort of their own individual moratorium, then, the licensure process itself should not be implemented. But again, agencies need to check with their own states. So, it's just important that they stay on top of what those, requirements may be. For organizations that might be subject to the moratorium, they may, if they're able to, they may want to consider continuing on with licensure, potentially having non-deemed, home health agency services, if they're able to, depending on the state, or even home care or what we call home care, non-medical, homemaker companion, or private duty nursing. If again, it's able to be provided without a home health agency license that requires Medicare certification, then agencies really need to think about, or providers get creative with what they want to be able to do, or may be able to do, to continue to, expand into the market and assist supporting patients and caregivers to the best of their ability.
Yeah, absolutely. I couldn't have said it better. And I really feel that hospices should now I know there are what you call the bad actors out there, and we have our hospices that are very compliant and following regulations. But during this pause, because of all of the lead up to this moratorium, at least for the hospice, I'll keep to my hospice knitting just for a moment. This is a great opportunity for hospices to really look at their performance, look at all of their metrics, look at all of the data sources and the data that may be available to them from external sources to shore up performance. This is what I'm thinking. Even if they're really good hospices, there's always room for improvement. And, think about how they're going to do ongoing monitoring of what is happening out there. Again, maybe they are a member of a state organization or a national organization, or they even read our compliance monitor a couple of times a month. I guess what I'm trying to say is, my thought is it's a good time for hospices to get back to basics, to make sure their foundations in compliance and quality are strong, and use all of those data sources that are available in order to do that self-assessment and performance improvement. And this is a really great opportunity for organizations to represent themselves in terms of their quality footprint outside of their measurable scores reported on Care Compare. So if they have significant partnerships in their in their community, rather, if they've won awards, if they have relationships with various payers, this is the time to distinguish yourself from those bad actors, in my thinking, to show that you are a quality hospice, that you're not part of that, churn and burn scheme, that you're not part of and which has now become an endemic fraud and abuse cycle that is happening in overall hospice. Taking the opportunity to figure out how you're going to do that, put that information out there to show that you are reputable, that you are compliant, that you are working with CMS, and that you're not going to walk the low road of compliance or quality, that you're definitely walking the high road of compliance and quality. So I'm going to get off my soapbox now, Kim. And I'm going to ask you to go on your soapbox for home health, in terms of, what do you think home health organizations should be doing now during the moratorium?
So all I can say to that, Jennifer, is ditto. Basically, everything. You just said it all. Really, it's all of those efforts for both hospices and home health agencies who are existing providers to really be able to demonstrate, again, the value that they bring, their own have their own internal compliance, and quality oversight, programs. Again, having a corporate compliance program and our compliance standards at CHAP really do align with the 7 elements of the OIG 7 elements of an effective compliance program. So really putting that into place, but also, certainly at CHAP, we have, through our Center for Excellence and Learning Solutions, we have disease program certification. We also have age-friendly care at home, and pediatrics, pediatric palliative care. The certifications that can set an organization apart as a differentiator in the environment, certainly will. I do also believe that also demonstrates the strength and diversity of an organization and the commitment of an organization to really meet the needs, grow to meet the needs of the patients that they serve.
Absolutely. And, it's CMS is adopting that proactive versus, what they've called in the past pay and chase type of mentality. So
Yeah.
I don't think it's out of the realm that we would see tightening at the beginning of the enrollment process coming out of a moratoria, as it relates to home health and hospice. And I know we have both fronts seen more tightening in rulemaking in the last couple of years, but it seems to me that CMS knows what they want to do as it results or relates to the enrollment process, and they just need to figure out the logistics of how to get that done. But I am thinking also we're going to see increasing of other types of activity, and let's talk about that for a couple of minutes, like, increased scrutiny on documentation, for example. What are your thoughts on some of the activity that could happen at the provider level? And then, we can talk about what's happening at the accreditation organization level as well. So let's start with provider level.
Correct. From the provider level, we've already seen a lot of the activity through the MACs and the other CMS contractors and the auditing. So while we are, as an AO, we focus on survey and regulatory, of which in there we also have seen significant increases in terms of, more focused reviews, if you will, or more scrutinizing of surveys and follow up by CMS. And of course, we now have the direct observation validation surveys, which are CMS contractors joining the AO on site with a survey to observe the AO processes. Things like that, as far as really more, I think, boots on the ground and really looking closely at oversight. But CMS also has indicated that during this program, they're going to be, or the moratorium, they're going to be looking at their program analytics, and as well as and continuing the effort that the administration and CMS has put forth with really involuntarily terminating organizations. And I think by and large that a lot of that does have to do with looking at billing practices and documentation. Like I said, we've had, the alphabet soup of audits for quite some time. We don't expect that to let up at all. In fact, it likely will be, even increased. So
I agree. And, we as an AO have been feeling the squeeze over the last couple of years, particularly the last, let's say, 8 months. You did mention the doves, but what are some of the other things that we can talk about that's happening on our front as an AO?
well, I think you and I can tag in together on this, but really we are seeing more inquiries from state agencies and from CMS regarding follow-up, their own follow-up, regarding organizations where they're asking for more information. For example, if there are multiple providers in one address, location, or one building, if you will. We know from the example of Friar Street in Los Angeles or Glendale in California that this is we've heard it. We've seen what the inquiries are, which tell us that CMS is looking at areas such as that as well. And like I said, we do a very thorough review, triple layer, if you will, not counting your quality team, just on accreditation alone, to make sure that the surveys are valid and appropriate, and the findings are sufficient. The evidence supports the findings, and we certainly are able to through that process ensure that providers that we are accrediting are meeting the standards. What we're seeing more of is either outside of our surveys, again, these questions directly from CMS or the state agency, and a lot of times it has to do with it appears as though it has to do with things like I said, physical location, and then in some cases with the involuntary terminations. Again, from the information we can see, it appears as though it may be billing related. So agencies we can't stress enough. Organizations have to maintain compliance with both survey readiness, COPs, regulatory requirements, and the billing and payment requirements in order to be able to really make sure that they're actively addressing all of these areas. And there are a lot. And oh, by the way, above all, ensure the quality and safe patient care.
Absolutely. Are there any other things you think providers should be doing right now during this period of moratoria?
No, I think I think you made the best point. I think for organizations that are currently enrolled, take this time to make sure that your house is in order, that patient care is, of top quality, and you can demonstrate your own compliance and your own quality, within the organization. And I think that's most important there, and looking at your outcomes and processes. For those providers that were not able to make it before the moratoria, taking a look at what options there are made to enter the market again through non-deemed, accreditation or home care or whatever ability they have to be able to begin to serve patients, develop their model, and be ready for when the moratorium is lifted, because CMS did say that anyone who was not able to submit an 855 during the moratorium, once the moratorium's lifted, they'll be in a high screening, and be able to move forward if they submit that 855 within 6 months that the moratorium is lifted. So, in addition to operationally everything we talked about, making sure that they keep their ear to the ground, certainly between national associations, state associations, and of course, us, CHAP, our updates, and yes, your fabulous compliance monitor and all the other resources that we are making available for, certainly both our customers, but also for the industry, for the public to be able to review, to utilize, is really important.
Absolutely. It's going to be important. So every piece of information, scrap of information is going to be critical to monitor. So my friend Kim, final wrap up, epiphany, thoughts.
No, I feel like we've said it all. I just can't say enough. Again, the line in the sand, May 13th. And if you were under the deadline, if you will, before May 13th, keep moving forward, but understand that CMS and state agencies are still looking, very closely. And for current providers, we can't stress enough the importance of a compliance program and a survey readiness program and a quality program to really make sure that you not just are crossing the T's and dotting the I's to the letter of the regulation, but operationally your organization functions it demonstrates compliance through their functions, through staff, through the actual evidence of patient care delivery.
Well said. And just a reminder that we will at CHAP will be keeping you updated via our new webpage that's dedicated to the home health and hospice moratoria. We've got information on that page, including FAQs and updates. And Kim did a great webinar on 5/15/26 about the moratoria. So all of those are available on our webpage, and make sure that you stay tuned not only to special email blasts and information that's posted on the page, but to our compliance monitor, where we'll keep you updated via that resource as well. So with that, I want to thank you all for taking time out of your day to tap into our podcast. From Kim, me, and the entire CHAP staff, keep your quality needle surging forward, stay safe and well, get back to basics, and thanks for all you do.